DNA results for some of the 429 bodies exhumed from the Shakahola forest will be out by next week, which will allow the release of the bodies to their families for burial. Chief Government Pathologist Dr. Johansen Oduor says the next phase of exhumation of bodies in the vast Shakahola forest will resume in March this year. Speaking at the ongoing KEMRI Annual Scientific and Health Conference in Nairobi, the government pathologist said the multi-sectoral team that is involved in the Shakahola exercise will meet next week, adding that they will ensure that all bodies are exhumed in the region. He attributed the delays to the high level of decomposition of majority of the bodies, the overwhelming number of cases, as well as lack of cooperation from some of the relatives of the deceased.
We did what is called management of human remains according to the standards. Yeah, what we are doing actually after doing autopsy, after ensuring that all the evidence are collected, we were doing embalming. Embalming is placing a body in formalin so that now the tissues are fixed. Once they are fixed like that, they cannot deteriorate any further. And we put in the body bag and zip them. And all the bodies are like that, so they cannot even deteriorate any further. So even the fridges are not even required now. Even though we are using them, they are not required. We repair them, they are fine, but they are not required. These are bodies which can even stay out for very, very many years without decomposing any further because of embalming.
Currently, we have a project that seeks to establish a reference mitochondrial genome database for the Kenyan population. And for the last 3 years, we've been collecting representative samples from all the ethnic communities or groups in Kenya, from all the geographical regions, which we have managed to do. We've also done sequencing of the mitochondrial genome that is representative of these communities in a bid to develop a reference database that can now be used by the investigators, like the people in government chemists and